This is Jerry Hesch with the Hesch Institute, and this is a case of knee hyperextension injury with posterior glide of the distal femur. And this is our website, heschinstitute.com, and that's spelled H-E-S like Sam, C-H. We are near Las Vegas, Nevada in Henderson. We do consultation and treatment for complex injuries, and we teach seminars and have a distance learning program. So this interesting case, if you'll go ahead and line your back, sustained a hyperextension injury to the right knee. And with passive accessory motion testing, we find that the hyperextension, when I lift the distal tibia up, the lower leg, into extension, and I'm doing that with the leg in relative neutral. And meaning it's neither internal rotated nor externally rotated. So this one is just a lot stronger and less range, has a firmer end feel. The injured side, I can go further and there's a softer end feel. When I palpate the distal femur, this is deeper, okay? And even up here, it's deeper at mid-thigh. We don't treat on the basis of appearance. So I'm going to spring the left side. So I'm loading it with perhaps 30 pounds, taking up the slack, spring, and it recoils. And I can repeat it a few times, and when I let go, there should be a final recoil. On this side, because it is in posterior glide, I can't even take up the slack. It's at end range. So I'm putting 30 pounds, I'm putting 40 pounds and more, and there's no yield whatsoever. So I conclude that this is stuck in posterior glide. That will affect muscle function, but he's such a big, strong guy, I think we'd have to work really hard to demonstrate that in a brief video. I'm going to pass on that, but what I'm going to do is treat that distal femur and bring it back into anterior glide. You want to give us a couple of words about your injury and what it feels like to you?
Yeah, it feels, I just stepped into a shallow hole, maybe 12 inches, with my leg locked. It was an unexpected hole. And ever since then I've had stiffness and kind of swelling around the fibular posterior lateral area. And it's when I squat, it pops and gets more swollen. And it just feels odd ever since.
So the knee was extended already when you stepped into this depression, so you then hyperextended.
That's what it felt like.
Great. So it's congruent, you know, your description is congruent with what we find. Refresh my memory, when I started to evaluate you, I didn't know the mechanism of injury. Is that correct?
No.
The first time that I evaluated?
No.
So I found the behavior of the knee and then asked about the mechanism of injury. So that's that. We will stop filming, we'll treat it and come back and refilm, and thank you.